All right, I'll be the first to admit there are plenty of things in life that I put off, right? Like laundry, getting anything done at the BMV. But when it comes to my health, and I'm talking to all the women out there today, there truly is no excuse for delaying that annual exam with your OB. In this segment sponsored by Avina Women's Care, I'm happy to have Dr. Tracy Cook here to share more. Hi, Dr. Cook.
Hi. Hi, Robin.
All right, let's start the conversation today. I just want to share a little bit more about Avina Women's Health and really what you guys strive to do, in your practice.
Yeah, so we're Avina Women's Care, and we are 43 providers in 13 locations all across the greater Columbus area and including out into Marysville area.
Okay.
So we provide the highest quality individualized patient care using evidence-based medicine.
Okay, and so your list of services, I'm looking through it, it is vast.
Yeah. Yes.
You pretty much do a lot of the basics,
yes.
right?
Of course, we do obstetrics, but we also do gynecology. So for our obstetrics patients, the prenatal care, the postpartum care, but for our gynecology patients, it's really the caring of patients through the gamut of their lifetime, from puberty through childbearing through menopause, and like you said, covering those annual checkups that they should come in for every year.
And beyond that, because I also think it's interesting, you do some kind of additional things. So you have maybe the basic prenatal, postnatal, but you also have postpartum yoga, massage, prenatal.
Yes.
So it's making sure too that your patients are taken care of in every kind of realm of their life.
Yes, we have Reclaim Medical Aesthetics and Wellness. We do offer prenatal yoga and prenatal massage there. So we're trying to come at it from all different aspects. But yeah, so we're about healthy moms and healthy babies primarily, but we also really focus on just the individual woman and her health care for a lifetime.
Absolutely, and you do outpatient kind of minor surgery there even too. So having all that under one roof, how important is that to a lot of women?
It's awesome. People love the one-stop shopping.
Yeah.
So again, the mammogram facilities, we have 3 different locations that offer mammograms, but we do offer outpatient surgery, some minor surgery that we can do in the office, some outpatient surgery in an ambulatory surgery setting, and we have robotically trained surgeons that can do like major hysterectomies.
Great. Yeah. Okay. And then you have the doctors that you know and trust too, which is so important, I think, to patients. And I mentioned in the introduction kind of that annual exam, and I was telling you I'm a breast cancer survivor, so I understand all too well the importance of that annual exam. And I was also young, so I think like even the women who think, well, I'm not 40 yet or I'm not 50, I don't have to make sure I get there every year.
Oh, but no, you do need to get there every year.
Yeah. Tell us what's done at that exam.
So with the annual exam, first it's a conversation, and it's all based on age-based recommendations. So, for the young woman, they should get their first pap smear at age 21. For women older than 21, we have a conversation. We call it the shared medical decision-making model. So you have a conversation with your physician based on your risk factors, based on your desires. We make recommendations for when to have a pap smear, when to have a mammogram. For menopausal women, we talk about bone density testing and colon cancer screening. For younger women, it's about birth control, or it's about fertility services if they're trying to get pregnant and having difficulty. So, we cover the gamut, the vaccinations, before pregnancy, during pregnancy. So. Yeah.
There's a lot involved having had a couple of babies. I know that it's always great to kind of understand too and have that relationship before you get to that age and you know and trust your provider.
Yeah.
And then I want to talk about the mammogram. We hear various things. The ages have changed. The recommendations have changed. What do you talk about? What do you guys recommend as far as, when to start that?
Yeah, I recommend starting at age 40 and doing an annual screening mammogram, thereafter. So once a year, in addition to the clinical breast exam, which is what we do, part of the physical exam, it includes the breast and the pelvic exam. And then, of course, we talk about the self-breast exam, and so, we guide people on that as well.
Yeah, that's how I caught mine, was because I was too young for the actual mammogram at that point. So all good stuff, all great information. And you do focus on that lifetime relationship.
Absolutely.
What is that like? Because now you've known people probably through all those phases,
Yeah, I've been doing this for 26 years.
Yeah.
And so what I value most is that patient relationship that I have throughout the lifetime. So I have now patients that are children of women that they were the baby that I delivered, and now they're a patient coming in for their, whether it's, their first, visit to the gynecologist about their menstrual cycles or cramps or something. So that to me is the most important aspect of what I do, is that, relationship that I have that spans the lifetime.
Okay, so how does somebody reach out and find, a provider, find a doctor or location since you have so many of them?
Perfect. Yeah, so we have our website, Avina Women's Care.
Yeah.
Again, we're 43 providers. We have obviously physicians, we have nurse practitioners, midwife. We have 13 different locations. So you can go to our website, Avina Women's Care, and schedule an appointment. And there's phone numbers, locations. So we're all part of Avina Women's Care, but we have all the care centers. So go to the website and you can find out how to reach us.
No excuse in delaying that annual exam.
No
All right.
excuse.
Doctor, thanks for being here.
Thank you so much, Robin. It's nice to meet you.